Hi, everybody. This is Shawn Wade. I want to welcome you to our webinar today, Family and Community Engagement 101, Maximizing Volunteers for School Health. We're still waiting on a couple more people, and we'll get started at about 2 minutes past the hour. Okay, welcome everyone. We'll go ahead and get started now. I'd like to welcome you to the webinar again, Family and Community Engagement 101, Maximizing Volunteers for School Health. Just a few notes on logistics. You can see there, if you have a question, you can go ahead and submit it in the question box on your control panel there. But right now we have everyone muted and the call is being recorded. I will also be sending out a link to the recording and handouts following the call. I want to talk a little bit now about Action for Healthy Kids. This webinar is brought to you by Action for Healthy Kids. My name again is Shawn Wade. I'm the manager of volunteer initiatives at Action for Healthy Kids. And our vision is a world in which every kid is healthy, active, and ready to learn. So what that means is that we work to mobilize school professionals, families, and communities to take actions that lead to healthy eating, physical activity, and healthier schools where kids thrive. I'm having just a little bit of technical difficulties right now, so I'm going to pause on sharing my screen and get back to you in just 1 minute. So sorry about that. Okay, and we're back. Sorry about that delay there. But just a few notes about Actions for Healthy Kids. We were founded in 2001 by former Surgeon General David Satcher, and we have been around working with schools and communities to make healthier kids, to make schools where kids can thrive, healthier schools where kids can thrive since then. We do a variety of different things and programs, but we focus mostly in schools with school grants for healthy kids, school programs where we provide technical assistance on ways that schools can be healthier. We provide trainings. We have a Parents for Healthy Kids, a brand new Parents for Healthy Kids program with a website called parentsforhealthykids.org, which is a hub where parents find information on how they can make their schools a healthier place. And every year we award Healthy School Heroes, which are, you'll hear a little bit more about that later on in the broadcast, but those are some of our all-star volunteers, parents, school leaders, administrators, teachers, anyone who is going above and beyond to make schools a healthier place. I also want to mention the Learning Connection. The Learning Connection is a great resource where you can find out the connection between physical activity and nutrition and how that leads to healthier schools and healthier students and furthering learning initiatives in school through healthier students. I also want to mention our signature program, Game On. Game On supports America's schools, their staff, students, and families to incorporate healthy food choices. It's a six-step program where schools can follow and really incorporate healthy food choices and physical activity into lives of students throughout the school day and throughout the school year. Game On, as I mentioned, is that six-step program. The first step is about gathering your team, a school health team that can make a difference in the school. The second step is about assessing and tracking progress and how you can do that. The third step is creating and implementing an action plan to really put your school health programs in place. The step 4 is finding activities where you could go online and see some really great activities that we have planned and created that you can use to implement your action plan. Step 5 is the step that we'll mostly be talking about today. That's about engaging families and communities in your school health programs. And step 6 is about receiving recognition and applying for a certification where you can be officially certified as a health promoting school. So as I mentioned, today we'll be talking mostly about step 5, engaging families and communities. So I want to introduce myself and our panelists today. My name is Shawn Wade. I'm the manager of volunteer initiatives at Actions for Healthy Kids. I work with our national office and I work with our schools and community and corporate partners throughout the country to implement and design strategies for getting more volunteers, family members, parents, and community members involved in your school health initiatives. We also have two great panelists with us today, Deborah Feinzinger and Becky Rinker. Both are winners of a 2017 Healthy School Hero Award. They are phenomenal people and great advocates for healthy schools and for Action for Healthy Kids. Deborah is in Palm Beach County, Florida, and the School Health and Wellness Coordinator at Alamanda Elementary School, and Becky is in Gibsonia, Pennsylvania, and she is a member of the District Wellness Committee at Deer Lake School District and also a very engaged parent. They'll be joining us later, and I'll give you a little bit more information about them as we go along. I also want to mention our school, family, and community initiatives. We'll talk about this as we go along, but we believe that these partnerships are essential to creating healthy school environments that are impactful and sustainable. For these partnerships to be successful, parents, families, and community engagement initiatives need to be intentional, comprehensive, and creatively designed to fit the needs of your particular school community. And that's really what we'll spend most of the day today talking about. We are also strong advocates of the whole school, whole child, and whole community model at Action for Healthy Kids. Today, school districts across the country are exploring and adapting this so-called Witek model. It's a whole child approach, but takes a really specific health and wellness focus. The Witek model highlights the school health components which every school should have to ensure the health, safety, and well-being of their school environment for students and staff. And there are 10 components of the Witek model, but the two that we'll be focusing on today are family engagement and community involvement. Those are the two that really gather exterior people outside of the school building to really drive the whole school, whole community, and whole child model and the school health initiatives. So today what we'll cover are some benefits of engaging family and community volunteers. We'll start with kind of an overview of family and community engagement, who should you involve and how they can help you advance your school goals. We'll also share some strategies and resources you can use to develop a family and community engagement program at your school, and our guest speakers will provide some tips and examples of those strategies in use. So we're going to start today with a quick poll of how you currently engage family and community volunteers at your school. With this poll, you're actually only able to choose one selection. So I ask that you choose the one that maybe you use most often. But otherwise, we would typically have a multiple selection. I know sometimes you are able to do more of these things in your school, but just choose one, the one that is the most common in your school right now. I'll give you about 30 seconds to complete that poll, and we'll go. Great. Seems like a lot of people with organizing or helping with events is kind of the strongest one. A few on the school health team, which is great to see. And some with fundraising efforts and ongoing opportunities. And only 6%, it looks like, or a few more than that, that don't currently engage family and community volunteers. So that's great to see. But a lot of organizing and helping with events, which is what I suspected, but that's great to see. So I want to first talk about the value of volunteers. To enact all of the grand plans that you have for your school health initiatives, you almost definitely need to enlist the help of others from time to time, as it seems like most of you already do. Regardless of the actual tasks that they do, all volunteers have at least one thing in common. The time, energy, and resources that they can bring can be really critical to and important for a successful outcome. Volunteers can bring really a lot of value to the table. Advantages of engaging volunteers from your community and from your school families include they may have specialized knowledge or skills that can be very useful to complement or enhance your efforts. They can provide a new and different perspective and bring in fresh energy. Volunteers can provide a lasting impact and contribution. The more people that get involved, the easier it becomes to gain additional support for your work. And finally, volunteers can really save money for the school and do a lot of good work for little to no cost. Because of that enormous amount of help potentially available from your volunteers, an important question to ask is how can we best tap into that resource? So that's really what we will be discussing today, of how you can get families, parents, and community members involved. So typically volunteers will have a motivation for getting involved. A lot of the time it's that they are really interested or that there's a personal satisfaction, a strong, good feeling that they get from volunteering, and often it is out of the goodness of their hearts or that sort of selflessness. But then there's also can be a friendship or social aspect, and because they have the time and ability to do so. So when one person is involved, sometimes you can ask them to bring a friend along next time to get more volunteers engaged, and that's something that they would be interested in as they're interested in that social and relational motivation. And finally, one of the strongest motivations is the level of commitment, or because they have a passion for the cause. So you'll get a lot of parent volunteers, a lot of community volunteers that are really excited to help with school health because they're passionate about that cause. So it's just important to keep all of those factors in mind when looking to start or strengthen your family and community engagement. In order to really engage those volunteers from families and communities successfully, it really must be a mutual partnership between you and the volunteers. So a little bit of initial planning can pay dividends when it comes to recruiting and involving volunteers. The first thing that I would suggest keeping in mind is who you're targeting as volunteers. Each group will likely have different motivations for getting involved, and you may want to slightly change your communication tactics with each group. Second, when engaging volunteers, you have the ability to do much more with limited resources, but keep in mind the need you are wanting to fulfill. So a few things to remember. You want to let volunteers know exactly what is expected in terms of their time commitment and be mindful of their time. Assure the volunteer task is appropriate and that the volunteer is comfortable performing the task that you have asked them to do. And communication with volunteers is really vital. Make sure that the volunteers know exactly what the needs are, what the task is, and who can answer questions that they may have throughout their involvement. So language like, we need your help with this task because, and giving really specific examples is going to go a long way to letting volunteers know that the work that they're doing is going to have an impact. You also want to build real connections with your volunteers to get to know them and make sure that they are getting to know one another. That's especially important for families in the school, parents and other extended family members as they want to get to know other parents and be able to bounce ideas off of each other and take time to connect with each other and beyond just the bigger picture of health and wellness in the school. But connecting the dots as to the why of their volunteer task is going to be really important. We don't want to assume that they know right away. We want to make that obvious. And finally, but maybe most importantly, we want to make sure that the volunteer is valued. Explain how their task relates back to the bigger picture or end goal, and that their involvement is integral to the success of the school health plan. Remember that small incentives like offering healthy refreshments to volunteers and saying thank you can go a long way. So I really want to, as you're thinking about expanding or even starting your family and community engagement, think about who in that network might have skills or interests that meet or could complement some of your needs as a school health team. Then brainstorm ways to get individuals, organizations, and businesses engaged so that they can help you meet those needs. If you need help getting started, Game On activities are a great way to get started. They have ideas around different things that you can do, and each includes volunteer tips. With each of these things, you want to identify the key stakeholders. As we discussed, there's lots of different areas where volunteers are necessary and around, but these are the kind of key stakeholders in any school health team and school health and the success of your school health plan. We talked a little bit earlier about the Witek model, the whole school, whole child, whole community model, and the family engagement component that's a part of that. So I want to really kind of delve more into that right now and talk through what that looks like from a family perspective. It looks like families and school staff that can work together to support and improve the learning, the development, and the health of all students. And it's really going to be something that is shared between school staff, families, and the students that are benefiting. And it's going to be most effective when school staff are committed to making families feel welcomed, when they create an environment that's a welcoming environment where families are engaged and know that their contributions are valued. So I want to start with sort of a model that Action for Healthy Kids has developed for parent engagement that really revolves around, it's sort of a three-tiered parent engagement model. And it looks like an inner core where there is at the center of your school health plans, those parents and family members that are really taking the initiative to be a leader. And then kind of the next level out is those parents that are participating in school wellness activities. They may come to a health and wellness fair. They might volunteer at a field day, but they're not necessarily on the school health team. But those are the ones that are participating in activities and events at school and are knowledgeable and involved in what's happening. And then the outer school is those, the outer circle is those that are supporting school and family health at home. So they may not come to the events, but they're going to be really important in learning. Maybe they're reading some of the handouts that you send home with students, but they are, and then reinforcing those at home. So that's going to be an equally critical component. That's the largest circle. That's probably most of the parents, but it's a really important part of a school health plan. So talking a little bit more about the inner core, these are folks that might be serving on the school health teams. These are your ultra committed volunteers, your parents that are taking initiative, that they are participating in the decision making, that they may take the initiative to train other parents and share information, share news of what's happening, or what is coming up, invite other parents to events, that they are taking initiative to be experts, follow their passion about a specific or a couple specific school health issues, and get to know more about policy or legislation or maybe district policies. They're also the ones that are developing programs, leading projects, writing grants, and bringing in more districts and community partner and leaders. The next circle is that middle circle. These, as I mentioned, they might be volunteers or attendees of your events. They might participate in some activities, screen-free week, for example, or walk or bike to school days, or provide healthy school snacks or refreshments for school events. And in this circle, there's an opportunity here. These are folks that are clearly engaged. They're interested in helping out, but they haven't taken that next step. And there is an opportunity there, I think, to really engage with these folks and get them to that next level of maybe joining a school health team, or bringing more parents involved, more parents along to get involved. And then that outer circle, like I mentioned, is going to be really important for the sustainability of your school health programs at home. So they might understand some children's health issues, they might understand some wellness issues, they might provide nutritious meals and opportunities for physical activity at home. And these are folks that you can, again, there's an opportunity there. They're very valuable in that exterior circle, but there's an opportunity to move them up to that middle circle and invite them to those activities, to your events, and get them more involved with what they're doing, so that they are not just modeling those healthy behaviors, but they're also getting involved, bringing other folks along with them. But these are the ones that, as you get to know who these folks are, and probably your teachers are going to be the most effective at understanding which parents fall in which circles, and then communicating that and helping them to move up the line. So as you're thinking about any of these, there's some really critical questions to ask around your school health team to figure out whether or not you're kind of where you fall in the level of being prepared to execute some of your school health plans and involve parents and families and engage them in moving up sort of from that outer circle to the middle circle and to the inner circle. And so I would encourage you to share these with your school health team, to share these questions with other parents and school faculty members that are interested in your school health programs, but really take a minute and have an honest conversation and really look at these questions, whether you understand what your family's values. Do you know what level of engagement parents are currently at and ready for? Do you share responsibility with parents to identify needs and make decisions? Are you really in a place that you can empower students and parents to help make those decisions? And are you connecting with community partners to help reach parents maybe that aren't as receptive to kind of traditional models of parent engagement? So I would encourage you to use this kind of list of questions as a resource to take back to your school health team. And then I also want to mention that with any parent engagement, building authentic relationships is going to be really that key strategy to help move parents and families to the higher level of involvement. those authentic relationships where you're building true connections with the parents, getting to know them on a personal level and not just on a level of their involvement in the school. They're going to value that and want to come back more and more often in those situations. So now, as I go along, if you have any questions, please don't forget to insert those into the question bar. But I want to introduce our first panelist to talk through some of her experience as both a parent and a district wellness champion in Deer Lake School District in Gibsonia, Pennsylvania. Becky Rinker is one of our 2017 Action for Healthy Kids Healthy School Heroes. She has done an enormous amount of work in the district where she's based with her kids, and around aeroponic gardens, around school gardens, around physical activity and nutrition, and just really making wellness a part of the school culture. So I'm going to turn it over now to Becky to share some of her experiences and some tips that she has on how to engage parents and families at a deeper level in your schools.
Hi, Shawn. Thank you so much for that. And all that information you shared so far was just wonderful. I took a lot of notes to bring back to our wellness committee. So yes, I've been a member of our wellness committee for a couple of years now. And I believe that, you know, if we can teach our kids how to be healthy from when they're young on up, they won't have to struggle or have it be a challenge as they become adults. So, you know, if we can make healthy a habit now, it's just going to benefit everyone later. So, you know, that's really my why behind why I am part of our wellness committee and so passionate about it. We've done a lot of really wonderful things in our district, and a lot of that is because we have such an amazing team of people that have come together over the last few years. We've done everything from, as you can see here, school gardens. We have a tree orchard, a fruit tree orchard that was planted last year. We do healthy food tastings. We do with smoothies and also salad tastings and other healthy snack options so the kids can try different things. We have a farmer direct program where local farmers come in and share, you know, information about their crops that they raise, and the kids get to sample them and they learn information about that. We have a kinesthetic lab where the kids interact with learning and fitness at the same time. So we really try and do that cross-curriculum learning and incorporating brain breaks throughout the day. And we just have so many good things, but it's this combination of really great people that has come together to make this happen. We do a lot of grant writing. There's so many grants out there, and it's so worth it to try and go for those because that's how these programs are brought in. So, you know, how do we find these people? You know, it's definitely a challenge in some regards, but when you start to really look, there are so many people out there that can be brought into the picture. All the key pieces, of course, within the district, the administrators and your, you know, health and PE and food services, all of those parts come together. But then the volunteers. So, you know, where do we find these volunteers that we need? We need these people. We need more like-minded individuals. And, you know, my first suggestion to find those people is to think about who everyone knows that is living the mission, who is living this mission of health within your district, and ask those people. You know, a lot of times we think, well, they're seeing what we're doing, you know, they'd want to be involved. Of course, they would just come to us if they were interested. But I find a lot of times people aren't sure where their role lies, or how much just comes from the high district level down that maybe they wouldn't be able to have an input in. But when they find out that everyone can have input and make things happen and have a piece, whatever their passion or interest or skill might be, can be put to use. So really it's asking, that communication piece right there. It's so simple, but so many times we're afraid to ask. So, you know, starting out with that list, have your wellness committee think of who they want to sit next to them in this room, right? If your district doesn't have a wellness committee, you know, you can just start with a small group of people who would be interested, those key players, and go from there. The other thing that works in our district, so we have a district district-wide wellness committee that meets once a month, but we also have individual wellness committees within each of our school buildings that meet on a monthly basis, so that they can target what is going to work in their specific building, in addition to what we're doing district-wide. Another piece that we mentioned, and Shawn, you mentioned it as well, but the communication is so important. Parents are really busy, and even though they may want to help, they may not feel that they always have the time to dedicate. And I think as a wellness committee, it's important to be open and welcoming, and to let people know that whether they can give a little or a lot of time, that their support is welcome. You know, and put out specific needs that may be happening, and always communicate, you know, when there is a meeting or when there is an opportunity where they can help within a certain school or, you know, district-wide type of program. Some simple things that, you know, I think we overlook, and it's a little old school, but suggestion boxes. You know, these are great ways for people who may not know exactly if their idea is going to work, or maybe they've got a thought and they don't know where it's going to go. But if you have them maybe in a teacher's lounge or you know, front office area where people can put in suggestions, I think that those are ways that somebody can say, all right, well, that was a great idea. Where do you want to go with it? You know, get in touch with the person who put in that suggestion and see where you can go. I find that we have so many resources and parent resources that are out there, but we don't know how to tap into them. And surveying people, maybe it's through something like I said, a suggestion box, or maybe it's a Survey Monkey, where people are answering questions that can lead us to, oh, this person has that connection, and we can bring that program into the district through that community connection. So I think that is a really untapped resource, and we have all these parents out there. We just need to reach out to them. And, you know, of course, the simple things like email connections, social media outlets, websites, and then, of course, going back to the basics of personal invitations. People really respond to that because, you know, you're going from that list of who's living the mission and inviting them in personally. So I think that's a huge thing. And another idea that I wanted to share with you real quick as well, I attended a wellness symposium through Let's Move Pittsburgh today, and they introduced a really interesting concept that I haven't experienced before, but it was called the World Cafe Method. I don't know if anybody's heard of that, but it basically is they pose a couple of questions and you move around in groups and you discuss these wellness topics, and then, you know, you're mingling with other people who have different backgrounds and experiences, but it could definitely be something that could be used within a school district with parents to find out what they want from school health, or where they have ideas, and where bringing people together is going to make those ideas come to life. So I thought that was very interesting, and we definitely are going to employ something like that in our district to, you know, into like a wellness night or wellness workshop. So we're already working on that a little bit. And I guess, you know, just again, being open and inviting and getting that communication out there, and asking again, like more than once, you know, even twice, 3 times, because sometimes the first 2 or 3 times people overlook it, they may not hear, and then it clicks. So like they say, busy people get things done, so don't be afraid to ask. So that's pretty much
Great.
what I.
Thank you so much, Becky.
Thanks, Shawn.
Yeah, absolutely. And again, if anybody has questions for Becky, please go ahead and use that the question box on your control panel to enter those in, and we'll get those answered either today on the presentation at the end here, or we'll answer via email later. Becky, what was the name of the what did they call it at the Pittsburgh Symposium? I missed the name of it. It was like a, go ahead.
Yes, so the symposium was on growing healthy children, and it was through Let's Move Pittsburgh, and we had wellness and thought leaders from all around Allegheny County, which is where I'm located, discussing, you know, all the different wellness topics in schools. So it was really kind of a perfect lead into today with what we're talking about, but it was the World Cafe method. So you basically, it's kind of like a active workshop, you know, where instead of you have your speaker on one side of the table telling everybody information, it's really an interactive discussion on certain topics. So I thought that that could be really well utilized in finding out, you know, pinpointing some people who could be leaders in your own school and become active on your wellness committees, as well as come up with ideas that perhaps, you know, from a district level, they're not seeing in a, you know, a classroom level or a student level or vice versa. And putting those pieces together to come up with some really good wellness initiatives.
Awesome. Yeah, thank you. The World Cafe method, cool. I think that's a great way. And all of your tips really are. I think the main thing that I heard you saying a lot is really reaching out, doing the outreach to parents, getting their feedback, getting their opinions, and and listening to what the parents in your community and in your school have to say, and then continuing to ask them and really make the effort to go out of your way to get them to get involved.
Absolutely. I think it gives people buy-in as well and makes them feel like their input in there is valuable to what the school's initiatives are. You know, I think a lot of times people may not even know. We think they know, but they don't know. So if we can just keep reaching out and inviting in, that circle is going to widen. So, you know, look for other people that are involved in things, or like I said, living the mission, and that's a good place to start.
Great. Well, thanks, Becky. I'll go ahead and move on. I'm going to transition a little bit to from parents and families to community involvement. But I want to thank Becky again for joining us. And if I'll let you know if there are any questions out there, Becky, and we'll go ahead and get those answered toward the end of the session today.
Great, thank you.
Yep. So again, going back to that Witek model, the whole school, whole community, whole child. The other component of that was that we wanted to hit on today was the community involvement component. And I really think that community partners can be very helpful when it comes to engaging parents and families, and also important just as on their own as schools make an effort to be a part of a strong part of the community that they're in. So when thinking about what community partners you can engage and connect with to offer programming to your students or find funding, donations, and community volunteers, think about some of these organizations, partners that are typically available in most communities, whether it's a local business or a university or college or community college. There are often branches of national and local volunteer organizations. There are yoga studios or other physical fitness type of studios, gyms, things like that, parks, recreation departments. All of these can be great and may already have programs in place that would meet your needs, which would be a lot easier than just trying to invent something new each time. In the cohort of schools that Action for Healthy Kids worked with last year, only about 26% of schools reported having a community member on their school health team. So that's definitely something that I would encourage you to try to find if it's appropriate, if it's a good fit, but trying to find that community member that can be a part of your school health team, or even if not officially on the school health team, really getting involved with your school health work. Step 5 of Game On also really hits on engaging families and communities. So I wanted to mention a few things of how that step can really be useful in as you're working through your strategies. We do provide lots of resources for engaging families and communities throughout Step 5, and in the activities that we have are all centered around or all have a component of getting volunteers involved. I also here want to mention the new Parents for Healthy Kids website that Action for Healthy Kids just launched in partnership with the National PTA. This site has has inspirational videos of parent champions, tons of school wellness project ideas for parents and PTAs, and background information on school wellness policies and systems. That website is listed on your screen there, so please go ahead and check that out. I encourage you to make use of that as you can. And then a portion of Step 5 is specifically dedicated to engaging your local school community. There's information on involving community organizations, as well as how to recruit volunteers. And schools have the opportunity to host events on our Action for Healthy Kids events and volunteer management tool that is located within the school portal. And you can find information on how to use that and how to register events that you might have at the school on our website at actionforhealthykids.org in the volunteer section. So with that, and some words about engaging community organizations and within your community, I want to introduce another one of our 2017 Action for Healthy Kids, Healthy School Heroes. We're fortunate to have two on the call today, and Deborah Feinsinger is the excuse me, is the coordinator of the School Health and Wellness Committee at Alamanda Elementary School in Palm Beach County, Florida. And if I messed up your title, Deborah, I apologize, and you can correct me. But she's done some really great work at the school there, building some excellent community partnerships and building relationships with really making the school a thriving part of the community, and a lot of sort of long time partnerships and coordination that has gone into that. So I want to turn it over to Deborah now to talk through what that has looked like from her perspective, and to offer some tips on how other schools can take advantage of their local community. Deborah?
Hi, good afternoon. I wanted to thank you for inviting me today, and I enjoyed listening to what both you and Becky had to say. It's enlightening to hear, somebody from another state and see what's going on there. But I love that we're all passionate about the same thing, and the health and wellness of our youth and our future. I am actually fortunate enough because we are actually a health and wellness choice school. And at the present time, we have 80 children that don't live in our boundaries and choose to come here because of the programming that we have to offer, in addition to our rigorous academics that take place in the classroom. So I just wanted to highlight some of the things that we do here, and you'll notice that many of the things are because of our community partnerships that I've cultivated through the years. This is actually our 5th year being a health and wellness campus, and we're really excited about the new things that we put on our plate this year. So we started out with a small running club, and I had the idea of running because I started running small races, and I was introduced to a gentleman who is on a committee and was able to give me money to help children run in community races. And when I brought that to my principal's attention and asked her if I could have a running club, she actually was a little skeptical at first and thought kids aren't going to want to run in South Florida because of the heat. But we started out with 15 running club members, and as of today, in my 5th year of having a running club, we have 80 running club members. And as I was waiting for the webinar to start, I was inputting the information for the next 5K race that's taking place on a Saturday morning in our community, and I have 40 running club members that are going to participate in a 5K and a 1-mile race. And what happens there is we are going out into the community. Our children's parents are becoming a part of our running club team, and when we do events like that, we then network in those venues, and we meet other people, and it's like a snowball effect. So the last race we did last weekend, one of the sponsors of the race invited my running club members, and she paid for them and sponsored them to run in that race. So every time we go somewhere, we meet somebody new, and we try and share our passion about our healthy lifestyle, and it seems like they want to be a part of what we're doing. So running club is probably the catalyst of where we are today and started us off. And in the picture in the middle, you can see we're on a loop. That's 1/8 of a mile, and we raised $30,000 3 years ago with the help of Whole Foods, and that's a great company to work with. They did a 7% day for us and gave back to Alamanda, and we were able to help put some of that money toward building that loop. Whole Foods also sponsors our cooking club, which is one of our favorite clubs that we have after school. We have a primary cooking club and an intermediate cooking club, and they give us all of the food. They've even given us the bowls and the cooking utensils that are needed to make that program thrive. In addition to our cooking club, we also have a golf club this year. We started last year, and we reached out to one of the community golf courses, and they welcomed us with open arms and couldn't believe that, you know, we were coming to their club with 3rd, 4th, and 5th graders and starting our, you know, young children in the golf world, and they're so excited that they can be a part of that. We also started with a tennis club. We went to the same community golf course, and we went to the tennis club and asked if they would be interested in having some tennis kids from Alamanda. So we now have 18 tennis members and 12 golf members. And when we go to those clubs, we've, you know, asked those people for donations. We just participated in a silent auction at the Honda Classic Cares. And so those tennis clubs and golf clubs have given us, you know, free foursomes of golf. And so we kind of, you know, they give to us and we give to them, and it's a wonderful working relationship. So those are 3 of our favorite, well, 4 of our favorite clubs: the cooking, the golf, the tennis, the running. And those are some of the community partnerships that we have. One of our biggest events that we do to involve the most amount of community members is our yearly Health and Wellness Expo. And I know Shawn was mentioning, you know, about having yoga and dance and things at the school. We do that. We have yoga instructors that come and actually do a little demonstration with the children. We've had a karate instructor come, and they actually turned it into a fundraiser for us. So not only are the children doing karate, any child that signed up for the program, the karate school gave all of that money back to Alamanda. So now we're able to use that money for another health and wellness initiative. And so, of course, I reached out again for this year, and I said, our Health and Wellness Expo is going to look a little different. We're going to do it at night this year, and would you be interested? And of course, they're on board again. They got a lot of new members from our Health and Wellness Expo last year, and in turn, we were able to use that money, and we bought yoga balls for some of our classrooms. So we have 3 classrooms here that actually have no chairs, and they sit on yoga balls, and we're real proud of that. I was asked to speak at a symposium about 2 years ago, and I met a gentleman from the Quantum House, and he loved what we said, and I liked what he said, and so I just went up and introduced myself, and he told me that they had grants available, and I reached out to him and wrote a $30,000 grant, and now we have 100 desk cycles in our classrooms throughout the school, in addition to 15 stand-up desks. So I try to find out where there's places that I can go and meet people that are passionate about health and wellness, and I'm never afraid to go up to somebody and ask them for something or be a part of our world here at Alamanda. I do tours here at Alamanda, and I'm always asking people while I'm touring, you know, so they can decide whether they want their children to come here. I always ask them, you know, what they do and, you know, their involvement in the community, and I always try to tap into resources as much as I can. As a matter of fact, today, you know, you're talking about parent involvement. We started a club here called TAPS, and it's Teachers as Parents. We realized that we have 20 parents of children here at Alamanda on our staff, and so we're reaching out to them to be a part of our health and wellness initiative and working on some of our fundraising efforts that we're in the process of doing right now. So, you know, we're reaching out from within, although, you know, these are our parents and our community members all tied into one. All of the, you know, Orange Theory and 9 Round and Cycle Bars are always willing to come and be a part of our school. We have a wonderful program in our community called Triumph Kids, and they are a little exercise indoor sensory fitness room for children with autism and, you know, regular ed students. But Alamanda is a special place because not only do we have 710 children, we also have 130 children that are on the autism spectrum. So we're always reaching out and, you know, finding things in the community that are going to help meet their needs out there. I reach out to all of the healthy food venues such as Raw Juice or Juice Plus, Nutrition Smart, And Raw Juice has become a huge partner of ours. I know Becky mentioned, doing some Tri-Days, and we do what's called Tri-Day Friday. And Raw Juice gave us enough quinoa to feed 650 children last year. That was our population number. And so all of our children were able to taste that food. Some of them liked it. Some of them were not sure, and some of them were definitely willing to try it again. We had a Tri-Day Friday last Friday using some of our health and wellness money, and we served oatmeal in the morning for breakfast. We also have a Tri-Day Friday coming up with one of our local farmers who I'm a very big business partner with, from Pero Family Farms, and he's bringing some okra and peppers for the children and baby cucumbers. And he also provided kale and lettuce and baby peppers. I did a make and take in a mason jar for all of our teachers at our last faculty meeting, and I reached out to another farm that gave us some other items for our salads to take for the next day at lunch. So I'm constantly, emailing, I'm calling, I invite them to our programs, but definitely reaching out to as many community members as I can. I've already reached out to the police department. They came last year and did fingerprinting with our students, and I always love having the police around. It's just, it makes me happy, and I love to see the relationship that they build with the children as well. Some of the other things I wanted to mention, grant writing, and like Becky said, there are so many available. You have to look and pick and choose. Some of them are overwhelming, and they're very difficult to write. It's hard to really understand what they're asking for, but there's some out there that are much easier to write. So, if you're lucky enough to tap into some of those, I think it's a community grant writing. I'm not sure, and I could be wrong, but the Honda Classic Cares, I know they do a lot with Palm Beach County. If you're willing to look and see if it's open to other counties, that is an amazing grant. We wrote one last year and received $5,000, and we got training from the mindfulness program with the Goldie Hawn Foundation, and 45 of our staff members were trained in mindfulness and now implemented in the classrooms with the children. We will be bringing them back for a follow-up teacher training during the day, and at our Health and Wellness Expo, our parents will be have the opportunity to meet with the mindful training experts and have any questions answered and find out about the program. They'll be going home with some materials that they can use in their own homes. So it's just ongoing. I never stop. I wrote down on this paper, I said, I literally run down the hall to my principal when, something crosses my computer or I hear about it. Since we've been involved in golf, we're working on building a putting green right outside our media center. And I already had the gentleman here to measure it and, give us a quote. So I'm working on that through some of our fundraising efforts. And then my biggest endeavor, and hopefully it will be in the next year or so, we'd like to build a fitness center. Elementary schools don't have an indoor gymnasium. I know it gets cold in Pittsburgh and Pennsylvania, and you guys probably have indoor fitness. Well, it gets really hot in South Florida. So we'd like to have somewhere where the kids can go inside and still move around and have enough room to get some good exercise. And we also want to build a kid-friendly kitchen, because I feel that really you can be as active as you want, but what you're putting in your body is as important, if not more important. So learning easy tricks in the kitchen and using healthy items to put together some meals is really important. I talked to Shawn earlier, and I was just saying that I feel like we're interwoven with the community. A manager from one of the local restaurants came in today delivering something for his child, and I talked to him as he's walking down the hall, and we do a partnership with him. We do a 5% back or 10% back on certain things, and he donates food towards some of our fundraising events, and I just keep that communication open. He is at Brio Tuscan Grill, and we are in our third year of our 5K annual Strive 5 for the Hive race, and he opens his doors so our runners and participants can have breakfast at the restaurant in the morning. So it's just one thing after another, and we build and we try to do something new every year. and know that the children are, enjoying all of the activities that we bring to our school is important, and knowing that they can have these, fitness activities for a lifetime, and hopefully the things that we share with them will last a lifetime, a healthy lifetime. So I enjoy being here today, and I hope I was able to give you some helpful tips. I definitely am walking away with some information that I didn't think of before. So if I can answer any questions, I'd be happy to do that.
Thank you, Deborah. I appreciate all of that information, and it sounds like kind of the main theme is just, I think you said it, you just never stop. It sounds like every time you see anything in the community that could be helpful, you go up and ask and kind of just keep hitting the ground and kind of shaking the trees and seeing what falls out. Absolutely, absolutely. Good. We did get one. It's not a question, but I will connect you. There's someone from San Antonio that would love to connect with you offline about how you positioned the school as a health and wellness campus. So I'll go ahead and connect you to offline so that she may have some questions for you that way. Okay. Wanted to take the last couple of minutes. Thank you again, Deborah. If there are any other questions, again, go ahead and use that question box at the bottom of your controls. We'll get those answered via email offline or after the presentation today. But I do want to wrap up today, and I'll briefly show some slides with some resources in just a minute. I will also be sending out the full slide deck that has those resources and these links in it so that you can use those that way. We just want to kind of close with some next steps and some ideas on how you can kind of take what you learned today and move forward in the future. There's a link there that is a great sort of needs assessment tool from Volunteer Match, so you can go use that and kind of identify some of the needs that you might have that parents and communities can help you to meet. You can then brainstorm, like Deborah was saying, anybody in the community, anybody that can possibly help, go brainstorm some of those potential partners and then go ask. It never hurts to ask, and oftentimes, as she was saying, you get some really great results. Another thing that I would recommend is really familiarizing yourself with any school level or district level policies on volunteers and what those contain. Or community partnerships as well, if there's memos of understanding or things like that you need to get done. And then I'll challenge each and every one of you to ask 2 family or community members, as both Becky and Deborah said, really just asking it can be an important part, making people feel not just feel that they're welcome, but making them know, making it obvious that they're asking, ask and ask again. So ask at least 2 family or community members to be a part of your school health team, or if you don't have a school health team, asking them to be part of a small committee to move forward with school health policies. And then as you go through with any of the things that you learned today, please make sure that you're also appreciating your volunteers and giving them more opportunities to help. As I mentioned, just really quickly, as we're running up against the end of the hour here are some resources on family and community engagement. There's also some resources that we have available on our website for the school events planning guide and the events and volunteer management tool that I mentioned earlier that you can use. We also want to do a quick plug for Every Kid Healthy Week, and Every Kid Healthy Week is every April, the last week of April every year, and we really encourage everybody to participate in that. It's just a week-long, a month-long celebration of school health programs throughout the country. Over 1,400 schools participated last year. We're looking for even more this year. So stay tuned for more information on Every Kid Healthy Week, or you can check out our website there and get some more information and some resources there. And finally, as I mentioned before, that Parents for Healthy Kids website that we've just launched has some really amazing resources on how to connect with parents and how parents can connect with each other. So I encourage you to check that out and promote that to your parents as well. And then there's just a quick plug for getting nationally recognized via the Healthier U.S. School Challenge, where schools can get recognized as a official health promoting school. And again, if you have any questions, please feel free to email me or put those in the question box, and I'll make sure to get those answered. And One last plug for our social media sites. You can follow us on social media, Facebook, Twitter, Pinterest, for more ideas and resources as we go along. And that's all I have for today. Again, you can check us out at actionforhealthykids.org and parentsforhealthykids.org. And I thank everyone for taking the time today to join us. And I hope that you were able to take a few things away. And I encourage you to reach out if you have any questions or any other further ideas that we can use in future resources or tools for engaging families and communities, because I know all of you out there, not just Becky and Deborah, but everybody listening has other ideas that you've used in the past, and I'd love to hear those as well. So thank you again. Please let me know if you have any other questions, and have a great rest of your day.